Good evening, everyone. So, on behalf of Roots Education, I, Priya Malhotra, welcomes you all to this exclusive webinar on effect of COVID-19 on MBBS in abroad. The aim of this webinar is to spread awareness about COVID-19 and to address apprehensions and concerns. Our expert panelists for the day are Admiral Dhowan, former Chief of Naval Staff, Indian Navy, and Air Marshal Dr. Pawan Kapoor, Director General Medical Services, Indian Air Force. To give you a brief about our panelists, I hope you can see on the screen the brief profile of our esteemed panelist, Admiral Dhowan, PVSM, AVSM, YSM, retired, former Chief of the Indian Navy. He was the 22nd Chief of the Naval Staff of the Indian Navy. His illustrious career began with being adjudged the best cadet and winning coveted telescope during his sea training on board INS Delhi. The Admiral assumed charge as the Vice Chief of the Naval Staff in August 11, subsequently promoted as the Chief of the Naval Staff of the Indian Navy. He retired from the Navy on 31st May 2016 after a distinguished career of 42 years in uniform. He is currently holding the position of co-chairman at Roots Education. Now, I request Sir Admiral Dhowan, sir, to please brief our audience about this effect of COVID-19 on MBBS in abroad.
Good afternoon, ladies and gentlemen, and dear students. It is indeed a privilege for me to share my thoughts with all of you on how we are tackling the challenges of COVID-19 and its impact on medical education, both in India and universities abroad. The coronavirus pandemic is indeed the biggest disaster the world has experienced, perhaps since the Second World War. It has impacted every aspect of human life and spread across the spectrum from being a medical crisis, an economic disaster, and a social and humanitarian crisis. Extraordinary circumstances require extraordinary actions. And today, India is united under the leadership of our Honorable Prime Minister, Shri Narendra Modi, in this war against COVID-19. The Honorable Prime Minister has taken some very swift and decisive actions of implementing the lockdown, screening, testing, and containment of the virus across the country. We are indeed fighting the battle on many fronts. Our doctors and health workers are the frontline warriors who are doing an outstanding job in the hospitals looking after the infected people. This indeed is the time to salute our frontline warriors and those who are providing the health and sanitation workers, and also those who are looking after the security and essential services like our armed forces, the paramilitary forces, the police, and those ensuring the availability of essential supplies to our citizens. All these COVID warriors have put service before self in serving humanity and the people of this great country. The government has also announced a financial stimulus to counter the challenges of the economic crisis and to meet the requirements of the industry, the farming sector, the small and medium sector enterprises, and the poor and needy. A series of initiatives and actions have also been taken by the governments, both at the center and the state level, to feed the poor and put money in the hands of the workers. Indeed, the entire country is united in taking this calibrated action and to fight the war on two fronts. First is to save lives, and the second to ensure livelihood. While we are fighting this crisis against COVID-19 with resilience and resolve, we also need to keep an eye on the future, on life beyond COVID-19. One sector which will certainly witness significant investment and growth in the future is the health care sector in India. India currently has a shortage of doctors and medical facilities, particularly in our rural areas, and growth and investment in the healthcare sector will open up many avenues for students among you who aspire to be doctors. To become a doctor in India is indeed a dream, not only of the students, but also of the parents who want their children to pursue a respectable career. And medical profession is indeed one of the most noble professions and a most satisfying career where you can serve humanity with pride. But pursuing a medical career in these challenging times is certainly not an easy task. And those of you who wish and aspire to be doctors will need to inculcate some very special qualities as medical students. I would like to recommend the C4I, which stands for commitment, compassion, courage, credibility, and integrity. Commitment towards your profession and your career. Remember, this will be no ordinary commitment because you will be pledging your life in the service of humanity. Compassion as a doctor towards your patients and also towards your colleagues to work together as a team. Courage to fight the challenges such as the coronavirus and many more challenges which will be there during your medical career. Credibility as a professional doctor, which you will have to build up painstakingly over the years. And finally, integrity, which has to be beyond doubt always and every time. Currently, medical education in India is both highly competitive and expensive. This is where RUS education comes in to provide you with an opportunity to study in medical universities in Russia and abroad. In the current difficult times, when India and the world is grappling with a pandemic, I'm sure there are many questions in the mind of those who want to pursue their medical studies overseas. You would be thinking, is it safe? Is it affordable? Is it even feasible? What are the experiences of the students who are undergoing these crises in university abroad? And many, many more questions. All your questions will be answered today by an expert team of panelists, and I'm sure the vibrant discussions and the answers to your questions will serve to provide wings to your dreams and assist you to transform your dream of becoming a doctor into a reality. Jai Hind. Thank you. Thank you, Priya.
Thank you, sir. Now we will move to our next panelist, Air Marshal Dr. Pawan Kapoor. Sir has held the appointment of former Director General Medical Services, Indian Air Force, and former President Honorary Surgeon. He is currently serving as Vice Chairman in RUS Education. He is one of the founding members of NABH and been Chair of Technical and Accreditation and Ethics Committee. He is visiting faculty for All India Institute of Medical Sciences, NIHFW Public Health Foundation. He has published more than 50 journals, national and international, and textbooks. He has been awarded as AVSM in 2018, VSM in 2009 and 2017, COAS Commendation in 1980, 2004, 2008. His Order of the Royal Emblem from Sultan of Oman in 1984. Sir, we request you to please guide our audience and to start the webinar.
Good evening, everybody, and namaskar to everyone, to all the esteemed panelists, to all the participants, and also to all the parents and the students who have taken time out to come and join this webinar. We are grateful to all of you for sparing some time in the benefit of not only yourself, but in the benefit of this country. The Admiral has very rightly brought out certain major issues that may be of concerns, and we will make an honest attempt to cover all those issues. The aim of this webinar is not only to guide you towards medical education in India and abroad, but its primary aim is to create awareness on COVID-19, which is causing so much of apprehension in the minds of people. Also to analyze the impact of COVID-19 on medical education in India and abroad, and to apprise the respected participants on the efforts that are being currently and concurrently being put in by this education in support of both the current students as well as the potential students. And finally, we'll make an attempt to address all the apprehensions and concerns that are in the mind of all the potential aspirants as well as in the mind of parents. So I'll give a brief discussion about COVID-19. It is important to know the scientific basis of our apprehension. It is also important to understand that what you see in the media, what you hear in the media may not be all the truth. It may be in response to everybody who has become an expert on the subject, trying to impose or thrust his views on the general public who is craving for more and more news because they are afraid. So therefore, we must be very clear about what exactly are we talking about. Hence, I thought it may be prudent that before we go on to medical education, let us have some education about this disease called COVID-19. COVID-19 is caused, as you all know by now, a very novel coronavirus which started its spread in the Hubei province in Wuhan in China somewhere early last year, somewhere in early December last year. It was known as, nobody knew what was the cause of the pneumonia which was coming across in those people there. So it was kept under wraps for quite some time. After 3 weeks, when it could not be contained, and people were dying of pneumonia, then they understood that there is something wrong somewhere. So then they identified what was the cause. At that time, they named it as novel coronavirus. Now, what is this coronavirus? Coronavirus is the same virus which actually causes flu in the flu season. This virus has got various variants. This was another variant which was not seen before, so it was earlier named as novel coronavirus. Subsequently, they realized that this virus is causing severe acute respiratory syndrome. So they called it as severe acute respiratory syndrome virus 2. That means there was one virus earlier, which happened, if you all remember, in the year 2003, there was a severe acute respiratory syndrome caused by another variety of coronavirus, which was more deadly, but every 10th person affected died because of it. Today, when we see the COVID-19, we'll find the mortality rate or the death rate is far lower than what was caused by the first virus. And that virus was controlled. How does this virus, COVID-19 coronavirus, that is SARS coronavirus 2, how does it spread? Before I tell you how does it spread, let us understand how does it present itself. This virus presents in the form of fever, cough, sore throat, shortness of breath, running nose, feeling of uneasiness, feeling of pain in the body, sometimes with loss of smell and loss of taste, and various body aches. Now you will ask me, how is it different from other flu? Because all flus cause similar symptoms. Exactly, all flus cause similar symptoms, but this is slightly different because its infectivity is more. It causes infections at a larger pace than other flu. When first time pandemic flu happened about almost a century ago, at that time these were the symptoms, and that was a novel virus. But today we all suffer from flu, but we don't bother about it. We say अरे वायरल हो गया है. It is a viral, ठीक हो जाएगा 4-5 दिन में. नहीं ठीक होता है, बुरा वायरल 7-10 दिन में ठीक हो जाए. So this is also something like that. But it has got higher infectivity. It spreads faster from person to person, and there are certain reasons why it spreads faster. It is not spread by airborne transmission. That is not proven as yet. It is spread by personal contact. And how that personal contact takes place? Through droplet infections. From where do the droplets come? They come from the mouth and the nose of an infected person. When he sneezes, when he coughs, these droplets, they come and fall on you, or they fall on the surface and they remain alive on the surface. Anybody who touches the surface and puts his hand on his nose, in his nose, on his eyes, in his mouth, he gets the infection. That is why the importance of various preventive measures to prevent yourself from infecting your own self. So it spreads by personal contact and spreads by droplet infections. And this is through what you call, when it settles on the various environment that you put your hands upon, then those become invisible dust particles. And those dust particles inadvertently you carry to your nose. These dust particles in medical terms are called fomites. Now, I told you how does it present, how it can be diagnosed. When do you say that you are suffering from coronavirus or COVID-19 infection? You must have high fever, and it is accompanied by either cough or a sore throat, or it is accompanied by shortness of breath. But it has to be fever and cough or shortness of breath or a sore throat. They are the respiratory symptoms. And in addition to this, you should have a history of contact with a COVID-19 patient or with a suspected COVID-19 patient, who can be somebody who is in the territory where there are hotspots today with a lot of cases of COVID-19, or who has come from abroad in the last 14 days, or who has come from a territory which in the last 14 days with whom you have had a contact. So it is, then you make a strong suspicion. But the only way you can diagnose it actually and correctly is by doing testing. There are two types of tests. One is an antibody test, which only tells to the degree of extent the population has got the infection, but it does not specifically says whether the cause of this infection is SARS coronavirus 2. To do that, there is a real-time reverse transcriptase polymerase chain reaction test. Based upon this test, it is confirmed whether you are suffering from COVID-19 or not. How is it cured? Well, at present, many things are being tried. We only look after symptomatic treatment. If you are getting a pneumonia, you are given oxygen. If the pneumonia becomes worse, in that case, you are given some sort of non-invasive ventilation. If it still continues to become worse, then you are given mechanical ventilation. So you are trying to keep you alive till your body defenses fight the virus and you recover. Besides this, there are many other drugs which have been used with different successes. These are azithromycin, chloroquine or hydroxychloroquine. These are zinc and vitamin D are supposed to prevent. Now, these are all being published by different publications. At present, there is no 100% scientific evidence that this is being cured by that. However, more and more new methods of cure are coming out. It is by trial and error that we will know that this can be cured or not. But at present, these things are being tried along with certain antiviral drugs. There are about 4 or 5 antiviral drugs which were used in swine flu, which were used in HIV, and some new ones are being developed to ensure that we get a cure for this virus. In addition to this, we also know that the best thing to cure is to prevent it. We always say prevention is better than cure. So how to prevent it? Prevent it by preventing yourself from coming into contact with anybody who is a potential case. You will never know who is the potential case. So you have to take preventive measures. And these preventive measures are very, very, very simple. What are these preventive measures? These preventive measures are hand hygiene, hand hygiene, hand hygiene. Wash your hands the moment they get contaminated with any surface. The moment you touch any surface which you use very often, like lift buttons, like your doorknobs, like the sidings of the beds, like the tables, like your mobile phones, like your laptop keyboards, all these are very often you touch. Please wash your hands with soap and water. Use routine disinfection practices. Please use 70 to 90% alcohol. If you don't have it, you can simply use water and detergent and soap to clean your surfaces. You can use bleach, home bleach, to disinfect your surfaces. So you can prevent it from spreading by taking personal hygiene measures. You can take respiratory hygiene measures. What are those respiratory hygiene measures? That put a mask when you are coughing, or when you feel like sneezing. You should either do it in a handkerchief, or you should be always wearing a mask. Whenever you go out, you should wear any type of mask that is available to you. At least it will prevent the spread of this virus to others. Also, remember that you have to maintain a distance of at least 3 feet, which is called social distancing. And the Honorable Prime Minister rightly said that the only vaccine at present to prevent this spread is a social vaccine, and the social vaccine is social distancing. Maintain a 3 feet distance from each other so that you are not able to spread this virus. This is how you prevent it. So preventive measures are very, very simple. Now, who are the high risk cases who have more chance of dying? Very strangely, this affects the elderly people. So your chances of dying become much more beyond 80 years, much more, still more beyond 60 years. Between 40 to 60 it is less, 30 to 40 it is lesser, below 30 it is virtually negligible. Why it is so? Because the immune system of people below 30 are at their peak. So they can take care of any load of infection. But as you advance in age, your immune system has aged, so the responses become poorer and the viruses become more active. Remember, this virus cannot live outside your body surface for more than 3 to 5 days. This virus only lives inside you, because it goes inside your body and replicates and then causes infection into you. So if your immune systems are healthy, you have less chances of getting major symptoms. So what are the chances of dying? The chances of dying, as I said earlier, if you are beyond 80, you have a 20% chance of dying of this virus. If you are between 60 to 80 years of age, you have got a 3 to 5% chance of dying of this virus. If you are 30 to 59 years of age, you have from 1% to 3% chances of dying. And if you are below 30 years of age, you have a 0.2% chance of dying. And below 19 years of age, you have a 0% chance of dying based upon the existing data analysis. So this is how you can die. Now, who are more? As I told you, elderly people are more at risk of dying. Out of these elderly people, who are the ones? Males. Surprisingly, this virus has got more predilection for males. If you see in India itself, there are 76% cases are males, only 24% are females. Elsewhere abroad, in US, in Italy, everywhere else, the chances of infection are 70% in males and 30% in females. So males are more prone, elderly males are more prone. Those who are having diabetes, hypertension, those having kidney diseases, those who are having heart diseases, those who have got lung disorders, those who are suffering from cancer, and those who are on immunosuppressant drugs, because their immune response is suppressed, is less, they have more chances of being in a higher risk group. Now let us see, we have our students. We have a current lot of students who are studying in Russia in various universities. We are having almost anywhere around 10,000 students studying in various universities in Russia, and they are all still there. What we have done is that we have ensured that all the guidelines which are issued by the respective universities, by the Ministry of Health of Russia, by the Ministry of Health and Family Welfare of India, and by the Indian Embassy, those guidelines are strictly adhered to by all the students. We ensure that the hygiene and sanitation practices in terms of hand hygiene, in terms of provision of masks, in terms of ensuring social distancing, and in terms of people staying compulsorily within the hostel premises is maintained. We interact daily with the coordinators who coordinate the student activities along with us. We carry out video conferencing between parents, student coordinators, staff, and students of all universities as regular intervals to listen to their problems, to listen to their administrative problems, to understand the anxiety and apprehensions, to also understand the anxiety and apprehensions of the parents. So when parents and students and everybody talk together, they realize what steps have been put together, including the management from Delhi and Rus Education staff and all the top management of Rus Education. All of them interact with parents and students, give them confidence, and as on date, none of our students are in any adverse condition. All are perfectly fine. Nobody has been infected and everybody is healthy. We are ensuring that we look after their mental health as well by providing them recreational opportunities, by ensuring that they are reading books, they are doing some physical exercises and yoga, and by doing some meditation, so that they are occupied, they study, as well as they concentrate on other activities, so that they remain both physically and mentally healthy. We are ensuring that they get a healthy diet all through their stay in various universities. We have opened a helpline number which is operational 24/7, which we have projected in our Rus Education website. We are monitoring the situation in each state in Russia on a daily basis. Number of cases, number of deaths, number of hospitals, number of healthcare facilities, and a number of students in various universities. We are having a regular interaction with the Indian Embassy to ensure that they are in touch with our students, to ensure that they have a total database so that all students can be contacted and their concerns can be addressed. We are also ensuring that their academic activities in terms of online classes, in terms of online assessments, in terms of online assignments, in terms of online examinations, all these are being conducted in without compromising their academic calendar. Now let us come to the reason why we started this. What is the impact of COVID-19 in medical education? If I say there is no impact, I'll be lying. It is not the truth. There has been an impact. And what is the impact on current students? Now I'll take current students, those who are already doing their MBBS. I have told you there has been some amount of apprehension and fear. But with constant and consistent counseling and interaction with parents and students and everybody, their apprehensions and fears have been virtually are now nil, because they understand that they are a healthy population, they're unlikely to be affected, so there is no need to panic. So they are continuing on their studies. These students have been taken care of. These students' academic calendar is continuing. These students are now well adjusted and adapted because they know that Rus Education is there to take care of them. Now, what about those students who are the potential students and aspirants who want to do medical education in India or abroad? The conditions in both the countries are going to remain the same. So these potential students are worried about their NEET 2020. When will the examinations be held? Will it be held at all? When will the next session start? Will there be delays? Should I appear? Because if there is going to be social distancing, will it be safe for me to appear for the examination? How long this virus is going to stay in the environment? So all these type of apprehensions are going to be there in the minds of parents, in the minds of students, and the aspirant students who wish to avail opportunities of continuing with this dream career of theirs of becoming a doctor. Now let us try to remove the apprehensions. First and foremost, let me share with you your fear, your apprehensions, they are natural, and we all fully understand them. But let us take it in a more holistic manner. As per data available till today, no student, and I repeat, no student has been adversely affected in the current pandemic of COVID-19 across the globe, which I am making a very strong statement. No student has died because of COVID-19. No student has been admitted into the intensive care unit of a hospital across the globe. Many of them may have had mild illnesses, a flu-like illness, but they have not suffered any major complications in terms of viral pneumonias or in terms of acute respiratory distress syndromes or in terms of multi-organ failure or kidney failures or liver failures. They have not suffered from these complications at all. Even in the heart of the center of Wuhan, where students remain exposed for almost 7 to 8 weeks, when we know within 14 days the students can get infection. None of the students even visited any hospital. They were only diagnosed by the test. They were not admitted in any intensive care unit from the heart or the epicenter at that time in China, from where students were evacuated. So you can understand that this disease does not affect healthy students, does not affect healthy individuals. Now, there's a question: how long lockdown? How long can we take a risk? Why should he not go tomorrow? Why should he go this year for MBBS? Why should we take the risk? We should put him in next year or put her in medical college next year. Why should my child appear for NEET 2020 this year at all? Let me tell you, as history tells us, and as the case with all the viruses, as the time passes, the virulence, that means the damage causing potential of a virus, and the infectivity of the virus will go down. To say that we will to get rid of this virus, no. So are we going to wait for this virus to disappear from the environment? It will not disappear. It will remain in the community like any other influenza and flu virus. It will cause some minor effects and will remain here. So how long can you keep your child away from this virus? So therefore, we have to ensure that we do not waste the year of our children because of apprehensions which are not likely to occur. As I given you the data, no student adversely affected in the worst case scenario. Subsequently, it's not going to be the worst case scenario. Moreover, if you see, India needs doctors. India has now understood that it needs more and more modern medicine qualified doctors. We require at least 10 lakh doctors to achieve the ratio of one doctor for 1500 for 1000 population. Today, we have got only less than 8 lakh doctors. India, with its limited seats, which they have increased this year to almost about 79,000 seats, cannot produce these 2 lakh doctors, because that this ratio of 2 lakhs will keep on increasing year after year. Today it is 2 lakhs, tomorrow it will become more, because our population is also expanding more. From where will these doctors come? So these doctors have to come from within what we have got. Nobody is going to come from outside to hold our hands. When you are sick, you want to go to a doctor. You need to see a doctor. So if we don't get doctors in time, and we ourselves do not allow our children to become doctors, and we say we will wait for this pandemic to disappear, it will definitely pass. This will go. And why I say, you must have heard an old story of Akbar and Birbal. Akbar told Birbal that make a sentence which will make a happy man sad and a sad man happy. And Birbal promptly said, this too shall pass. ये भी चला जाएगा, ये लम्हा चला जाएगा. So this pandemic will go away. And as I told you, when it goes away, it will remain in the community like any influenza virus. So our apprehensions are natural, but we should think logically and rationally based upon the data that I have provided to you, which is a very, very authentic data as on today. So please do not carry apprehensions about your child getting affected adversely. And that should not be the reason to waste 1 year of a child. There are many who are going to appear for NEET 2020 for the third time, but they might have a problem. If you waste 1 more year and appear next year, they wasted still 1 more year. So let us, I know once you increase in age, your ability to acquire new and new knowledge becomes lesser and lesser, and you take longer time to imbibe the same things which you can imbibe at a lesser duration of time when you are at a younger age. So your goal should be let your wards prepare with greater vigor than before for NEET 2020 and utilize this additional time. This is a God-sent opportunity for them to study hard and to qualify for NEET. If they qualify and they get a good opportunity in an Indian medical college, please get them admitted there. Do not waste your hard-earned money on colleges you cannot afford just because you are apprehension that if my child goes abroad, what is going to happen? At present, you have a very good opportunity because of the current trend. The fees are unlikely to be increased. Every year, the fees are increased in institutions abroad. This year, they are unlikely to be increased. So this is the best chance to avail this opportunity for affordable medical education abroad. And India and abroad are similarly placed. Rather, in most of the Russian universities, one faculty takes care about 10 to 15 students. In India, one faculty takes care about 50 students. Social distancing is more feasible there than here. So if you see in Russia, except Moscow, no other state has been so much affected. Because Moscow is a metropolitan city and there are a lot of travelers who come from Italy and Europe who travel through Moscow. Therefore, Moscow has got more severely affected. Moscow and St. Petersburg. Otherwise, other states are not so much affected. In spite of that, no student has been affected adversely in any of the universities. What has happened in India, same thing is happening abroad. So we are similarly placed. Therefore, when you have an opportunity to compare cost, to compare affordability, please choose an affordable institution abroad rather than wasting your hard-earned money on colleges which you cannot afford, but because of your apprehensions, you are willing to take the chance of going to unaffordable colleges because of your child's dream to become a doctor. As I said, the pandemic will go away. This too shall pass. The academic pursuit of your wards should not be governed by the pandemic. Pandemic should not be the cause to prevent your wards to becoming doctors. So make use of this time and opportunity. Let your wards qualify NEET and choose a medical college of their choice as per their merit and as per their affordability. So finally, my take-home message is that if your wards qualify and are unable to get admission in an affordable medical college of their choice in India, do not hesitate to choose government-recognized, good quality, affordable medical colleges abroad. We assure you accurate and precise information on safety, health, and security of your wards. We already informed you that how we are taking care of our students in Russia. Please do not hesitate to contact us on the following in case you need any support, guidance, or advice. Our toll-free number is here 1-800-833-3338 and our website is www.rootseducation.in. Dear friends, dear parents, dear students, we are here to serve you and the country. We are here to make you put aside your apprehensions, your concerns. We are here to ensure your safety, your security, your health, and your dreams are fulfilled for becoming a doctor that you all wish to become, and serving, coming back to this country and serving this country of yours, so that this country, because of the health inputs, because health is an investment, not an expenditure, because of your presence, this country can grow stronger and stronger and become healthier and healthier. Thank you very much, and Jai Hind.
Thank you, sir. Now we have questions from the audience. We can answer those questions.
What will be change in requirements in respect to medical examination reports? Okay. All right. There is at present no change in requirement in respect to medical examination reports. Your medical examination requirements remain the same, because when you go there, it will be around the month of end September, October, or November. That's the time when your sessions for the first year are going to start. By this time, the exact course of the virus would have been known. Otherwise, the admissions will be open and your medical examination criteria will remain the way they are, because nobody is going to do COVID-19 test on an unsuspected individual. So therefore, don't think that you will be subjected to COVID-19 test at that point of time. However, the situation prevailing at that point of time will determine and ascertain whether there is going to be a change in requirement of medical examination. As on date, there has been no listed change in requirement of medical examination reports. The month question is, sir, can we get information about the NEET and MBBS abroad admissions? Well, let me tell you, situation prevailing outside will determine, because there are almost 15 lakhs plus students who have applied for NEET. Will it be possible to maintain social distancing in various examination centers? So these factors have to be built in. And what is the spread of the virus? So taking this into consideration, as on date, they have decided that they will ask for change in centers if required. So at present, this is what it is. Now, based upon this, at present, the sessions are going to continue, because in Russia, in the same manner as earlier, somewhere in October, end of November, and some universities in December also. So end October or beginning November, or somewhere between beginning of December, admissions can continue to be taking place in Russia, and those sessions are not affected adversely as on date, because our current sessions are going to continue and end in the end June or July. So that means the new session will start in time as on date. Okay, this question I've answered. What will be the deadlines this year for admission? I've already answered this question. Can we do MBBS this year from abroad? Definitely you can do MBBS this year from abroad. You come back to us, we'll give you the correct advice, which country you want to go, where you want to go. We'll help you out irrespective where you want to. You can definitely go abroad, because I told you that the virus, by the time end October and November comes, this would have lost its virulence, would have lost its infectivity power, and it would have come down to a routine community-based infection like a flu. So you can definitely go abroad this year if you do not get a seat in India. And if you get a seat in India and you do not get in a good government college, I would recommend that take a good, affordable global institution, because tomorrow you are going to be global doctors. This pandemic has proven one thing, that doctors are global. They cannot remain confined only to one location. So if you really want to become a global doctor, you must choose education from good universities, government recognized, MCI listed universities abroad. Yes, I fully understand people are now afraid of sending their children to abroad due to this pandemic. So how it may affect the admission to universities abroad? Is there any positive key points for the parents in this? Yes, there are positive key points for the parents in this. Those parents whose students are presently in Russia, it is better you interact with them. They will tell you the true picture. How safe their students, their children are more safe there. And I must tell you that when I interact with the parents, and I asked them, do you want your children to come back to India? Do you want us to evacuate them? Should we put pressure on the Indian embassy? And unanimously everybody says, no, sir. They are more safe there than here. We are talking to them twice a day. There are more chances of getting infection while coming to India than by staying there. So they do not want to come, let them to come back. So you ask the parents, the current lot of students which have gone through the Rus education, they have been kept so safe and so nicely that the parents have got so much of confidence in us that they don't want their parents, their students to come back right now, even if we want to give them that option. So you see, there is no, you should not be afraid of choosing an option abroad, provided you choose. I am not saying you choose Rus education or choose ABCD. You choose that organization who can support you when such situations arise. So examine those organizations. Do not go by any other parameter. See the length and breadth of the organization. See the credibility of the organization. See the ability of that organization to interact at interministerial level, so that if there is a problem, they can use their contacts to intervene and support your children in times of need. See all these factors before you choose somebody. Just don't go by attractive offers. Go by what is best for your children. My daughter is in first year at Rus. Is there any chance of coming to India before first year ends? What are the protocols we need to follow? Very good question. Okay. I do not know where exactly your daughter is, but let me tell you very simply that in Rus education, what we have done, we have obtained everybody's data and sent it to the Indian embassy. At present, everybody is of the opinion, including Indian embassy, that there is no reason for anybody to come to India. Why? Because it involves travel. The chances of acquiring infection in travel are much more. Thereafter, when they land to India, they will put in 14 days quarantine. In quarantine, they will meet many other people who are in quarantine, and we do not know who will be harboring an infection. So the chances of getting infected are more. Thirdly, after that 14 days of quarantine is over, they go back to their homes. Then the transportation to home may be an issue. And lastly, when they reach their home, they will be put up for 14 days under active surveillance. And in those 14 days, they may get the infection, they may remain asymptomatic, but they may pass on the infection to their elderly grandparents or to their parents who are suffering from diabetes and hypertension, who may get a much more bad response than what can happen to others. Therefore, at present, stay where you are. Like the Prime Minister said, our Honorable Prime Minister also spoken to the President of Russia, and they both have come to the conclusion Indian students will be taken good care of in Russia. Should a situation in Russia go much out of control, that they are not able to control and their systems get overwhelmed, and India is doing better, that time the Indian embassy has already been contacted. They are taking all the data and collated the data to ensure evacuation of students. If such a situation happens, it is not envisaged. So their their academics are continuing as usual. They'll have their examinations as usual, and they'll have their vacations as usual in case there is no international lockdown. Is it safe for the students to stay with their parents even after, say, 21 days of quarantine? As I told you, they will be in quarantine for 14 days. Then they will be sent from the quarantine facility. They will be allowed to go home, and they will be kept under active surveillance in their homes. And I told you before, the students are safe, but the parents will have to remain either isolate their wards for another 14 days, because we do not know in his last few days in quarantine whether he has contracted the infection or not, which will appear only within 2 to 14 days, the median time being 5 days. So for that much days, they should have separate utensils. They should have been looking after separately in a separate room and maintaining social distancing. Can COVID-19 affect admission process? In my opinion, it should not affect the admission into medical college, whether it be in India or it be in abroad. It should not, because as I told you, that this virus is going to lose its potency in the months to come, and will become much less virulent. And maybe by the by next year we'll get a vaccine as well. So if it continues to persist, we'll be having vaccine available. As it is, there is research going on whether hydroxychloroquine can be used as a preventive measure. So there's nothing to worry. The student community will not, and I repeat, will not be affected adversely. This is not my perception. This is based upon hardcore data available across the globe. What treatment will be given if 700 students are affected in the hostel? Now, this is a very good question, but this is a common question. First and foremost, if in the hostel they are carrying out under good monitoring, personal hygiene, hand hygiene, putting on mask, maintaining social distancing, ensuring that every item that comes in are suitably sanitized, in those circumstances, it is not possible. We have got almost 10,000 students in Russia today, and by the grace of God and touch put by the good efforts put in by the coordinators and by student community themselves, there has been not a single case. And therefore, there is no question. Now, if that possibility happens, what treatment? As I told you, at present, there is no treatment for this. Most of the students will suffer mild flu-like symptoms. Probably they will not be able to come to know that they have got the disease. So they will probably just have a common cold type of a symptom, and that symptom will go away. The only treatment required is giving symptomatic treatment, doing some steam inhalations, taking some paracetamol for fever. Yes, you have to report. Moment you get these symptoms, you have to report to the hostel in charge so that you can go to the hospital and you can be tested. And all students who have come into contact with you during this period of time, if you are tested positive, they are isolated. This knowledge and this awareness program we are doing on behalf of Rus Education in each and every university, that do not hide your symptoms of fear of isolation. There's one more fear that comes in, fear of isolation, because you may adversely affect your colleagues. So therefore, there is no problem. Even anybody has some problems, we have ensured that doctors actually come to the hostel premises and examine the students. We are checking temperatures in our hostels morning and evening of all the students, so that we are aware if anybody has slightest of temperature, that person is segregated from the others and they are examined by the doctors. So the situation of all 700 students being affected will not arise. I want to know about those universities abroad who are approving NIOS, that's the National Indian Open Schools students. Okay, I think you can get in touch with Rus Education. They will give you the brief of all the universities. I will tell you at present, all those who are eligible for NEET and all those who are qualified from National Open Institutes in India, at present they are eligible to appear for NEET 2020 because the SLP filed by the Medical Council of India in the Supreme Court, that has yet to be decided. Till then, these students will be allowed to appear for NEET 2020, and if they qualify NEET 2020, they can be admitted in any university abroad. For greater details, I would request you to get in touch with our counselors on this website and the toll-free number which I shown you, and you will be able to get further details. Sir, I am foreign medical student studying in China. Is it safe for me to go back and continue my studies in next semester? Okay. All right. It is a good question because I can understand your apprehension. See, at present, China, only the Wuhan province has been affected. The other provinces have not been affected as per the data available. China is not a very open country, so we do not exactly know the exact status of what is happening in China. However, when international flights open and the situation in China is okay and the university says that you can come back and continue your second semester, you can please go back and continue with your second semester. But please ask your friends and colleagues whether it is safe to go there or not at that point of time. So I do not know what is your which semester you are in, which year you are in. You can also get in touch with our counselor will advise you exactly what is the current situation prevailing, and they will ensure that you get the correct and the right information. As NEET has postponed this year, the relaxation in NEET will give to take admission abroad, or admission intake will extend. You see, NEET has been postponed, but NEET will be held. But if required, it can be postponed, and accordingly, the NEET results will be postponed. They will make an attempt to declare the NEET results earlier, and they will make an attempt to start the session in India somewhere in September, 1st of September. They might delay the start of the session to beyond September in India. However, it is also important to understand that in abroad, there are many universities will continue admissions till 31st of December. So if you are NEET qualified, you can take those admissions. The chances of NEET being cancelled this year are remote. If they are not able to hold through the routine manner, they are already working on alternative models for conducting NEET tests. Sir, the students who are studying in India, the students should write MCI tests so that the rates of medical seats price in India also will decrease. By considering this, if it is done, students can study in India only. Okay. What you are trying to say is students who are studying in India, and the students should write MCI test. Exactly. So all those who are already in India who require to write the MCI test, please write the MCI test and appear, because you are right. The medical seats prices might come down in India. There is no doubt about it. It may come down, and if it comes down, India can you have a choice to study in India only. Definitely, you have a choice to study in India. If you have got more affordable chances of getting a seat in India, definitely do so. But let me also tell you here one thing, that out of 15 lakh students who have registered, almost about 7.5 to 8 lakh students will qualify NEET. Now, out of these, you have got 79,000 seats. So imagine if all 79,000 seats are expended, and those who are done their third chance, I'm sure they are qualified, they would not like to waste a fourth chance. So you have the option of choosing abroad and other universities which are good, government recognized universities, MCI listed with affordable prices. You can choose those. But yes, it is true, if the rates come down in India and you get the merit, please go ahead and join. Will COVID-19 affect the admission process? Well, it will affect only in the terms of rescheduling in India. The dates may get rescheduled based upon the test being held and the results being available and the counseling being done. So maybe the session might get delayed by a couple of months in India. But as far as abroad in Russia is concerned, there are a lot of universities that remain open their admissions till December. And it is likely, seeing this situation, they may extend the intake period, reduce the duration of your vacations, and cover the semester so that you come at par next year. So this is quite likely. For admission abroad, COVID-19 will play a vital role to decide upon. In my opinion, please don't let COVID-19 determine what you should decide upon. COVID-19 should not hamper you. Corona should not stop you, because you are not going to be affected adversely. You wait and watch and continue compiling data till the month of September, and please check on the data where student community has been affected. So you will realize that it is safe for you. Rather, you are just, if at all you get affected by coronavirus, it is good for you. You will get some flu-like symptoms and you will be all right, and you'll be immune to it. So don't worry, corona should not stop you. This is the purpose of this exercise, of taking you and making you aware of the trend of what coronavirus is doing today. Since December till April, now we are in the last 10 days of April, the data shows very clearly it is adversely affecting the elderly males with concomitant morbidities and disorders. It is not affecting the healthy population so much. So therefore, you have nothing to worry. Don't waste your year. Is it possible that NEET 2020 will get cancelled this year? I don't see any possibility of NEET 2020 getting cancelled. It may get postponed further, but it will not get cancelled. They might choose another option which could be a computer-based option or a prometric center-based option. They may choose that, but this will not get cancelled. Don't lay your hopes that NEET 2020 is going to get cancelled, so I'll stop studying. Please do not do that. It will be the biggest blunder that you will make. Can we secure provisional admission for 2021 to avoid fees increase? Definitely. You can secure provisional admission now to get any problem in the academic session starting from October to December 20 to 21. Please don't worry about it. You can secure provisional admission, and you will be given the whatever the current fees rate are. If you wait for next year I'm definite the fees will increase. As I told you, what about the precautions in Russia for students? Are they being provided masks, sanitizer, or healthcare facilities like checkup and all? As I told you earlier, yes, they have been provided a mask, and new orders for masks has also been placed because some of the masks have become spoiled. We are ordering masks for them. We have already given instructions to all our students that firstly nobody will go out at present till the time they are in lockdown period. There will be only identified people who will go out to meet the needs of the students from the supermarket and elsewhere. Online market facilities are also being made available. All items are brought and kept in a centralized position. They undergo sanitization, and only then they are provided to the students. Students are advised to wash their hands with soap and water as far as possible. But when those who are coming from outside the hostel to inside, a sanitizer, alcohol-based sanitizer is placed, they have to sanitize their hand for 30 seconds. They have been taught the method of how to sanitize their hands, and that is what they are doing right now. They are undergoing checkups every day. Their temperatures are being checked. Okay, what is the procedure for admission abroad? The procedures you can check from the website of British Education. You can visit the toll-free number and contact our counselors. You can go on the chat box and give this. But broadly, I will tell you the eligibility criteria for are the same as they are in NEET 2020. That means there is at present there is you have to be minimum 17 years of age. There is no upper limit of age because that is also sub judice in Supreme Court. A general category student has to get 50% marks in physics, chemistry, biology, and biotechnology. SC, ST, and OBC has to get 45% marks for 45 percentile. 45% marks in this, and they have to secure similarly 45 percentile and 50 percentile mark to qualify in NEET. So it is the same criteria what is available for NEET. If online class exam tests can be done, is it safe to send them home? Well, the conditions prevailing at that point of time will determine whether it is safe to send them home or not. So that will be mutually discussed between the parents, the students, and the administrative staff in the university, and the decision will be taken at that point of time. Flight services have been closed now, and no one knows till when. Therefore, my question is how students will be back to India in June month for vacations. At present, the vacations are planned for July, August, but we will see the situation prevailing, as I said earlier, and then we will take a call what is the right thing to do. At that point of time, it should be safe for the students, safe for the university, and safe for the parents. I think the same, more or less the same question about vacations and examinations in Russia. All those who have given these questions pertaining to the current students, we are having every day we have with each university of ours, we have a combined video conferencing with them, and we will answer these questions again. Raise these questions during those video conferencing meets, and we will answer you. We've already answered these questions for those who have raised it in the previous meetings. Thank you all very much. Thank you, Priya. Thank you, Admiral sir, for all your support, encouragement, and guidance. Thank you, Research Education, and thank you, participants, for being there in such large numbers and for asking such interesting questions. Lastly, please do not be afraid. Do not carry any apprehension. We are there for you, and we assure you that your ward is safe there, and your wards, when they come to us, will be safe there. Thank you very much, and Jai Hind.